What are some of the tips you can provide patients about taking corticosteroids appropriately for immune checkpoint inhibitor side effects? When you're being treated with immune therapy, it's possible you get a side effect. And if you do get a side effect and it gets severe enough, you're going to be treated with steroids while the drug is either held or stopped. But there's a couple key points that you have to remember while you're taking those steroids. The first is, while we don't want to give you a lot of steroids, we have to give you enough. And if we start steroid therapy for any sort of immune-based problem, it needs to work in the next 48 to 72 hours. So if you make it 2 or 3 days out from starting steroids and the side effects aren't better, we need to give you more steroids. And you need to tell your doctor so that can be changed. The second point is that we can't wean you too quickly. That is, we can't stop the steroids too quickly, because if we do that, the side effects will come back. So in our practice, we're going to start you on steroids. And if it's not better in 2 or 3 days, we're going to increase the steroids sequentially until the side effects start getting better. Once they start getting better, we found the dose. And we're going to keep you on that for at least a week. And every week thereafter, we're going to make the decision. Are the side effects better? Can we wean the steroids or not? So a week later, if the side effects are getting better, but they're not really better, we'll probably keep you on the same dose for another week. And if they're a lot better or resolved, we'll start to wean you off the steroids a week at a time. Once you're on the steroids for a week, it's going to take a couple weeks to safely get you off the drugs. If we drop the dose and the side effects come back, we're going to have to put you up to the dose that worked. And finally, once you're on a lower dose of steroids, the equivalent of a replacement dose for what your body would normally make, we can resume the medicine to treat your cancer. We can resume the immunotherapy.